The following video is to help train staff in Tees Esquire Valley's NHS Foundation Trust in the importance of PROMs and specifically Schwemmwebs and how they can be used correctly in clinical practice. I'm Adam Tivernan, not only a service user within TUV, but also a member of their Experts by Experience group. I want to show how important Schwemmwebs, which stand for the Short Warwick Edinburgh Mental Wellbeing Scale, how important they can be for us the service user and use the clinician in building that all-important relationship, which is vital in helping us on our recovery journey. Schwemmwebs are used to monitor our well-being from our perspective and what impact, if any, interventions have had. We need to move away from this just being a ticky box exercise. If you don't believe in the importance of this paperwork, then how can we believe in the importance of it? Another really important part of the Schwemmwebs is enabling us, our service users and yourselves to plan our care together, which is vitally important going forward in our recovery journey. We need to be validated, we need to be listened to, and this is one of the steps that can be taken to help us achieve that together. We need to look towards the recovery goals of CHIME: connectedness, hope, identity, meaning and empowerment. And with this form being completed correctly and filled in together, that is very possible. It is your responsibility as staff members to ask us how often we would like to complete the Schwemmwebs form, be it as frequently as we would like, or every time we come in for meetings and reviews. It is vitally important that you ask us whether we need help or assistance to complete the forms, or whether or not we are able and more than willing to complete it ourselves. We need to work together throughout this process and to find out and to achieve what is best for the service user. The following film is not a depiction of anybody's personal stories or personal experiences. It is purely made up for the purposes of training.
Good morning. My name's Julie Small. I'm one of the nursing staff in the community mental health team here. And thank you for coming today. Did you manage to get here all right?
Yeah, I did.
It's your first time?
Yeah.
Yeah, okay, I'm glad. What I'd like to do, if that's okay, is I've had a letter from your GP to let me know some of the difficulties you've been having, but I'm much more interested in hearing from you as to what's happened. So there's lots of questions I'll need to ask you today, but I'm hoping that we can take it at your pace. And according to what you want to tell me. Does that sound all right?
Yeah, that sounds good.
Okay. Did you get a document sent to you with your appointment letter called a Short Warwick and Edinburgh Mental Wellbeing Scale?
Yes, I did. Yes,
you did?
I brought it with me.
Oh, lovely, lovely. Do you have any questions about that?
I would just like you to go through it a little bit for me, because some of it I was a bit unclear on.
Okay.
So if you can just go through it.
Of course, no problem. Did you get a copy of this document explaining what Schwemmwebs is?
I did, yeah.
Okay, that's great. So what it is, it's called a patient reported outcome measure, and it focuses on mental well-being. And it's a document that helps us and you monitor any progress. So it doesn't cover everything to do with your mental health, but it covers some really important areas. And if you're happy and you're willing to complete it at different points through your journey, it helps us monitor any progress and the impact any of our interventions have had.
Right.
Yeah. You don't have to complete it. It won't affect your care in any way. I can see that you've completed it for today, and I'm really grateful. What I'd like to do is use it as the basis for our discussion, if that's all right.
Yeah.
And then we'll move on to other questions. Is that all right?
Yeah, that's fine.
Okay. Is there any areas that you feel you would like to start from that feel like they're the most important?
I would say I've been thinking clearly. Well, I actually don't feel that I have been thinking clearly.
Okay.
Because obviously I've been suffering from depression, and it was about a year ago that I was suffering from depression. It went away, I was put on Prozac, but now it's come back again. But this time, alongside the depression, I'm also hearing voices.
Right.
And I'm finding that disrupts how I think and, you know, my ability to make decisions and things like that.
Okay, that sounds like it's been really really difficult.
It is.
And so you're saying that none of the time you're able to think clearly, so the voices are bothering you a lot, is that right?
They are. There's like two voices. One's my granddad, and he's very self-critical, you know, very critical of me, says I'm stupid and I shouldn't be doing that. And the second voice is a lady. I'm not sure who the lady is, but she's kind of a lot more accommodating, a lot nicer.
Right.
She kind of says nice things to me, sort of thing. But I find it very distressing.
I can imagine. So what she says is positive, and that sort of counterbalances what Grandad's saying. Yeah. How often are you experiencing them things?
I would say most days.
Right. So it's going to have a really big impact then. Yeah. Okay. Can I ask a little bit more about what the type of things that Grandad is saying?
He's basically just saying that you're useless, you're hopeless, nobody likes you, you're not clever.
Right.
I don't know, just general, just not nice.
So really critical, nasty things. Yeah. And you said that he says things that on here you're saying that you don't feel useful any of the time. Is that to do with the type of things that Grandad's saying, that the voice is saying?
Yeah, I think it's part and parcel of him saying like that you're useless and things like that. So, you know, I kind of think, well, am I useless? You know, it's hard not to not believe the voices.
Right. And is there anything that's happening in your life that does make you feel useful?
Normally when I go to work and things like that, that makes me feel useful. But unfortunately, I'm off sick at the minute. I've been signed off for 3 weeks.
Okay.
And I'm actually quite dreading going back to work at the moment. But normally, when I'm well, I feel quite useful in my work.
Right. How long have you been off work sick now?
I've been off work sick, I don't know, about a month now.
Right. Okay, so that's quite a long time. And if you're hearing these voices all the time telling you critical things and telling you that you're useless, I can understand why you're saying that none of the time do you feel useful. That makes perfect sense, and it sounds like it's really difficult.
The information gathered can be used to inform Honest Rating Item 6. Mary has described voices that she's finding distressing much of the time, and this has impacted significantly on her life.
You also said that you feel quite hopeless. So can I ask a little bit more about that and about your feelings about the future?
Yeah, sometimes I just don't really want to get out of bed. There is times when, you know, I think life would be better if I wasn't around.
Right.
I have no intentions of acting upon that. It's just, you know, that feeling that maybe my family would be better off without me, but I'm not a worthwhile person, I'm not a good daughter, you know, so I never would, simply because I just couldn't do it to my family. But, you know, it does crop up, the feelings crop up a lot.
Okay.
Mary has referred to fleeting thoughts of ending her life, but has not described a plan or intention. This area may need to be further explored.
So you talked about your family there, and I noticed that on here when it talks about relationships, you're saying that you don't feel close to people any of the time.
No.
Has that been something recent?
Yeah, since the second episode, at least. I've just been feeling very distant towards family and friends. Just don't want to be around people. I just want to shut the door and have nothing to do with people.
Okay. And are you finding that way of coping's helpful?
I think it's more damaging, to be quite honest. You know, I isolate myself because of it makes it harder. You know, the next time I want to go out or see somebody. And it's not fair, as I say, on my family and friends, because they want to spend time with me. They want to be around me, you know, and they do worry.
Mary describes social isolation and active withdrawal from relationships with family and friends.
You talked a little bit earlier about feeling a little bit anxious and worried about it. To what extent?
I'm anxious quite a lot, as you can probably tell. I think most of the day I'm just feeling anxious. It's like worry thoughts all the time. I get anxious even when I don't have the voices. I start thinking, well, when are they going to start again? What are they going to say? So even when they're not there, it's on the forefront of my mind at the same time.
Okay. So do you find that you can control the voices?
I try to block them out, but they're usually quite strong.
Right.
So.
Okay. So can I ask a little bit about the impact that that's having on you being able to make up your own mind about things? I can see on here you're saying that you're rarely able to.
Yeah. I find it very difficult to make up my own mind because obviously I've got the conflicting thoughts, or the conflicting voices, and they're telling me to do one thing and then obviously the woman's telling me to do another, and I don't know who to listen to. And then I think I shouldn't be listening to them in the first place. So.
Are you able to detach yourself from the voices and make your decision up for yourself, so Mary's decision?
I do try to, yeah, I try quite a lot. I do kind of act as a third voice and say, you know, this isn't real, this isn't what you should be listening to. You need to listen to your voice, your thoughts.
Right, that's really good. That's a positive thing that you've managed to be able to try to introduce to yourself there to deal with things. But it sounds like, I guess the reason you've gone to your GP and you've come today is you feel like you need more of a help with all of that.
Yeah, it's hard work and it's draining.
Yeah, and it's different from when you've suffered with depression in the past.
Yeah.
Okay. Can I just try to summarise what you've just told me, so I'll make sure I'm understanding clearly what you've said? Yeah. So you've suffered with depression and low mood in the past. You've never heard voices in the past, but most recently, for about the last 4 weeks, you've been hearing 2 voices, a male and a female. The male voice is Grandad's, and he's very, very critical. And the impact that that's had on your mental health is that you find it difficult to think about the future. You're off work sick, which has led to you feeling isolated, staying away from family and friends, not feeling supportive, not maintaining your relationships, feeling quite useless, and you find it really difficult to make up your mind and generally function on a day-to-day basis.
Yeah.
Does that sound...
Sounds a lot, doesn't it?
It does. It sounds like it's been a really difficult time. Yeah. Is there anything I've misunderstood there?
No, I think really you've just covered it quite well. Yeah.
Okay. I mean, I did say that this form won't cover everything, and I have got some other questions. Before we move on to them questions, again, I just want to thank you for completing that. That's given me a real insight into what's been happening with you. What I would ask you to do is complete this again before we review your care, and then that helps us see what impact any interventions that we've delivered have had. And if some of these areas aren't improving, we need to rethink and we need to negotiate with you what can we do to assist in these areas.
That seems like a good idea.
Yeah. So today isn't just about you giving me lots of information. By the end of today, I'd like you to leave here with some hope, particularly in regards of what we're going to do to help, because you've identified there some areas that really you do need some assistance with. Yeah. So if we can move on to some other questions, is that all right?
Yes, that's fine.
The clinical interview would continue and further questions would be required in order to allocate scores to the remaining HONUS items and other areas of a comprehensive assessment. As you can see, using the SWEMWebs is really useful in informing the clinical discussion and offers you real insight into the level of need from the service user's perspective. Most importantly of all, if SWEMWebs is used effectively, it can provide opportunity to listen to and validate the feelings and experiences of the service user.